Hello, my name is Dr. Jessica Quimby, and I'm a board-certified small animal internal medicine specialist, and my area of interest is feline chronic kidney disease, in particular, nutrition in cats and how to help our feline patients eat better and do better with their chronic diseases. So today I'd like to take a moment about assessing nutrition in the feline patient. And first of all, I'd like to say that for me, at least, for the patients that I manage, nutrition is a critical part of the clinical picture that I'm presented with. For many conditions, and particularly my disease of interest, feline chronic kidney disease, poor body condition is tied to a poor prognosis, as well as weight loss is tied to a poor prognosis. And we really want to make sure that we're doing the best we can to address weight loss in our feline patients. Additionally, we have to worry a bit more about our elderly feline patients as elderly cats are unique. And of course, cats in general are unique. We know that cats have higher protein requirements than other species, and they have a stable to increased metabolism as they age. Additionally, they just don't absorb foods as well as they used to when they were younger, and they may have also reduced digestibility of protein and fat. Unfortunately, then when they have disease, they're more likely to mobilize muscle instead of fat and can become muscle wasted. Additionally, I think the thing that I struggle most when working with my caretakers of the cats that I see is the effect of nutrition and appetite and eating on the quality of life of the patient. And many owners perceive unwillingness to eat as being very stressful, and they perceive it as being a part of quality of life. And really, this is one of the reasons why an owner may decide that the cat is no longer doing well, and we may end up electing to humanely euthanize that patient. So for many reasons, it's very, very important for us to keep them eating and to keep them doing well. And a huge part of that is the nutritional assessment that I make for my patient. And there's some really good websites. There's a really good reference for this for the WSAVA website in terms of a nutritional toolkit to use in your package. And they refer to this as the fifth vital sign. So when I think about a nutritional assessment, what I'm really thinking about is performing a weight measurement, looking at body condition score, muscle mass score, getting a good diet history, and also adequacy of caloric intake, calculating that for each patient every single time that they come in. And gathering this information is going to allow me to make a nutritional plan for that patient that will give us a good idea of whether they're meeting the goals that I have, and then how do we manage that going forward. And when I say adequacy of dietary intake, I do really mean making a calculation for that patient and having a good understanding of the foods that they're eating. What's the caloric density of those foods, and are we actually meeting those goals? So we can perform calculations for that. And if one of the easiest ways to do that, especially for most cats, is thinking about it as 50 kcals per kg, for instance, is a very rough way to determine quite quickly in your head what the caloric intake of that patient might be. So if you have a 4 kilogram cat, for instance, they may need about 200 kcals per day, and that's our caloric goal for that patient. It's also really important in my estimation and also the experiences that I've had with owners to ask the right question when you're asking a dietary history. We need to ask a good open-ended question to give us an idea of how that patient is actually doing. How are they approaching the food bowl? And if you simply ask, is the patient eating, yes or no, you may get a yes, but yes might mean 5 kibbles, or it might mean an entire meal and there's no problems. But if we ask a more open-ended question, like how is your pet eating, then we get all sorts of information. Like Mrs. Smith tries to feed Fluffy multiple times a day, and it's very frustrating for her. And some days the cat eats, and some days the cat doesn't eat. Sometimes they eat quickly, sometimes they eat slowly. And this type of very subtle information gives us a bit more input into the fact that actually those appetite behaviors have changed, and there's a good possibility that cat might actually not be eating enough. And so when we think about formulating a nutritional plan for that patient, again, that diet history is very important. And often what we discover is that the owner perceives the pet as eating well. So for instance, they'll proudly tell us, Fluffy's eating 2 cans of this diet per day. She's a very good eater. But if we look at what the caloric goal for that patient is, again, if Fluffy is 4 kilograms, she's probably eating about, or should eat about, 200 kcals per day. And then I look at the diet that the pet is eating. Maybe that canned food, especially those smaller, more like 3-ounce cans, are usually only about 75 to 85 kcals per can. Well, that means that in order to actually meet that caloric goal, Fluffy needs to be eating about 2 1/3 of those cans. And although 2 seems like a good goal to the owner, in fact, that means that that pet is chronically not getting the caloric intake that she needs. That may not seem like a lot, but when you're a very small cat, actually, you are very likely then to lose weight if you're not meeting your caloric goal. And that's exactly that identifying that problem, even that little difference, is potentially a big deal for these patients. So furthermore, we create these plans, but then we want to make sure that we're actually getting the follow-up. And this is where the hard part comes. Is the cat actually following directions? Is the owner actually able to determine what's going on in the household? Maybe they have multiple cats and it can be quite challenging, but we really set them a goal of going home and figuring out, what is the cat eating? Are we making our caloric goal? And it's very important to touch base again to say, are we meeting that caloric goal? That means that we do need to see that cat back for a nutritional recheck. So rechecking the weight, making sure that we're maintaining the body condition score and the muscle mass score. And if the cat, is significantly stressed in the hospital, what can the owner do additionally at home to monitor? Many of our owners get a baby scale at home to weigh their pet over time so that they can keep track of the weight. And we do teach them about how to do this and how to check things like, making sure they understand what muscle loss means on the cat when they're petting it, because they see them all the time. So once we have this nutritional plan and a nutritional follow-up plan, then we're much better informed in order to decide what to do with the pet from there. And really, this all comes down to when to intervene. It's very important to realize that in the feline patient, even a small amount of weight loss is potentially quite significant for them. So 5%. And if you're a 3.5 kilogram cat, that means 0.2 kilograms. It doesn't seem like a lot, but again, to a cat, if that's repeatedly happening and we're not meeting caloric intake goals, that's a concern that I'm going to be intervening to make sure that I'm really addressing that nutritional plan and trying to keep weight on that patient as much as possible. Furthermore, again, that this whole package of the nutritional assessment, we very much feel like weight loss is associated with this loss of body condition and muscle mass. That makes sense, right? But it's also tied to that inadequate caloric intake, and it's also tied to these more subtle changes in eating behaviors. So when we see those things start to happen, we have to make sure that we're addressing and assessing that whole patient over and over again every time we see them, to determine again when I would intervene. And I intervene and try to medically manage their weight loss and all of these things as soon as we see repeated, consistent issue in this regard. And that's, to me, is a very important part of managing my patient in their state of illness.